5, of course, the month of May, and we're talking about the Indy 500, but it's also a time to talk about another big topic. That brings us to your morning checkup. May is Lupus Awareness Month, and WISH TV medical expert Dr. Janelle Gordon is here to talk about an important thing here, lupus. Now, many of us that know about lupus, we know that it is an autoimmune disorder, but it works in so many different ways, it's just hard to diagnose, which is why you're shining a light on this one.
Yes, it's very important that we shine a light on lupus. So lupus is a chronic autoimmune condition that leads to inflammation throughout the body. It commonly affects women of childbearing age, however, men and children can be affected as well. In America, we have 1.5 million individuals who are affected, and globally, the number goes up to around 5 million.
Now, the symptoms range, Dr. J, because it can attack your heart, it can attack kidneys. There's so many different types of it, and with it already being hard to diagnose, many people just don't know what to look out for. But you have listed some symptoms that are pretty common within all those
Yes,
types.
so the symptoms definitely vary from person to person. Common ones that we see are chronic pain, extreme fatigue. So tiring that most of these individuals we see, around 89%, have difficulty even working full time. They may experience swelling in their joints, rashes throughout the body. A common rash that we see in individuals with SLE, the most common form of lupus, or systemic lupus erythematosus, is the butterfly rash, which covers the cheeks and the bridge of the nose. And a host of other symptoms and signs. Affects the heart, the lungs, the kidneys, and the brain, leading to severe complications in some individuals.
Now, we talked about this before we went on air. You know, I do have a friend that has lupus nephritis, and so the one thing that we talk about is that this is extremely difficult to diagnose. It often takes months, even years, to pinpoint that lupus is in the body.
It can, and so I recommend that individuals who may be experiencing some of these symptoms and they feel like they're not getting answers to their questions and concerns, keep a journal and document when your symptoms start, how long they're lasting, how severe they are, what aggravates them, what alleviates them, and make sure you share this information with your healthcare team. And if you feel like you're not getting anywhere, please search out second, third, and even additional opinions if possible. We do need more research in this area, so though it can affect women of childbearing age, the most common individuals who are affected are African American women. And we know that African American women are grossly underrepresented in research. Additionally, we've seen serious funding cuts this year at the federal level, and we know that last year the House of Representatives had allotted $10 million in the budget for the lupus research program. That unfortunately was cut this year, and additional cuts were made. We know around 57% funding cuts were made as it relates to medical research.
Disappointing to see for sure, but what we can do is to continue talking about it and put a spotlight on it to get more people aware about it, which brings me to my next question for you. Unfortunately, no cure, but how do you manage symptoms?
Yes, there is no cure today, and additional research will help with that. There is improvements in treatment. Actually, this week, the American College of Rheumatology updated their guidelines as it relates to lupus treatment for all of the types. And for the most common form, again, SLE or systemic lupus erythematosus, we recommend cutting back on the use of steroids or glucocorticoids, making sure we're using routinely hydroxychloroquine, and introducing immunosuppressive medications early. Again, there's an emphasis on shared decision making for the patient and the healthcare team. So if you're an affected individual and you feel like, again, you're not getting answers to your questions, you're experiencing side effects, a new medication is introduced by one of your healthcare team members, make sure all of the team members are fully aware, and don't hesitate to voice your concerns and opinions.
All great advice. We thank you so much for this morning's Medical Minute.